Hello everyone, let us move on to discuss the second type of adaptation, hypertrophy and hyperplasia. First, let's look at a case. A 68-year-old man with a long history of poorly controlled high blood pressure initially sought medical advice several years ago. His symptoms at that time were exercise intolerance and occasional peripheral edema. The patient's terminal admission was for signs of severe heart failure. The patient had mild peripheral edema and shortness of breath. He developed a cardiac arrest shortly after admission and died. In this case summary, the key points include a past history of hypertension, exercise intolerance, peripheral edema, and terminal heart failure. This is a close specimen of the cross-section of the patient's heart. What are the pathological changes in his heart? Follow me to find out the answer. Hypertrophy is another form of cellular adaptation. It is an increase in the size of the cells which together make the organ larger. Put in another way, in pure hypertrophy, there are no new cells, just bigger cells with an increased amount of structural proteins and organoids. Hypertrophy can be physiological or pathological, and is caused either by increased functional demand or by specific hormonal stimulation. One example is the physiological growth of the uterus during pregnancy. The increase in cell size is stimulated by estrogenic hormones acting on the smooth muscle estrogen receptors. In reality, uterine enlargement in pregnancy involves both hypertrophy and an increase in the cell number, that is hyperplasia, which we will discuss later. There are many causes in pathological hypertrophy, such as increased workload and hormonal stimulation. Some compensatory hypertrophy is pathological. For example, increased workload will lead to left ventricular hypertrophy in patients with hypertension. In the early stage, we have a compensatory hypertrophy. Later, with persistent hypertension, decompensation develops and eventually leads to heart failure. Now, let's examine the heart from our clinical case. Compared to a normal heart, what difference can you find? Yes, we can see the mild thickening of the left ventricular wall. There is also moderate thickening of the right ventricular wall. The slide shows the microscopic appearance of normal myocardium on the right compared to hypertrophied myocardium on the left. What is the difference? The muscle fibers are thicker and the nuclei are larger and darker in the hypertrophied myocardium. So, what's the diagnosis? Concentric hypertrophy of left ventricle. The following picture shows the heart from another clinical condition. Could you describe the growth morphology? This is the eccentric hypertrophy of the ventricular wall. It eventually reaches a limit and enlargement of muscle is no longer able to compensate for the increased burden, causing dilatation of the ventricle. Hyperplasia is an increase in the number of cells in an organ or tissue. Here, we should note that hyperplasia is an adaptive response in cells capable of replication. Could you list some organs which can undergo hyperplasia? Here we have a liver, breast, etc. The parenchymal cells of these organs have the ability to divide. Hyperplasia can be physiological or pathological. Physiological hyperplasia is usually a response to need, such as hyperplasia of the female breast epithelium and puberty or in pregnancy. Pathological hyperplasia can be the result of a variety of causes. Some of the important mechanisms include compensatory hyperplasia, excessive stimulation, and loss of regulation, etc. The picture here shows gross appearance of uterine endometrium hyperplasia due to estrogen production by an ovarian tumor. We can see polyps here. Under the microscope, we can see hyperplasia of endometrium glands and interstitial substance. These two photos show hyperplasia of the thyroid. Closely, we can see the enlarged thyroid, and on the cut surface, hyperplastic nodules are visible. Histologically, we can see nodules of different sizes and hyperplastic epithelium cells forming papilla. I think most of you would have heard about cancer. Do you know the main difference between benign pathological hyperplasia and cancer? Well, hyperplasia is regulated. If stimulation abates, the hyperplasia subsides. However, in cancers, hyperplasia is out of control. Pathological hyperplasia provides a fertile soil for cancerous proliferation. For example, patients with hyperplasia of the endometrium are at increased risk for developing endometrium cancer. This is one example of the clinical significance of pathological hyperplasia. Both hyperplasia and hypertrophy will lead to the increased size of an organ or tissue. What is the difference and relationship between them? Well, hyperplasia is an adaptive response in cells capable of dividing, while hypertrophy occurs when cells are incapable of division. They may occur together and are often in response to the same stimulus. Now, we have covered all the contents of adaptation. Here is the summary. Slow, persistent, gradually increasing or decreasing stimulation is the basis of adaptation. Hyperplasia may occur with hypertrophy. Hyperplasia, hypertrophy, and atrophy can be physiological. Metaplasia is always pathological. Here are the references. Thank you.